In this video today, we're going to go through the main antibiotic classes and give you a simple way to remember the drug names within each class. Now, there was a previous EasyMed video where we walked through all of these antibiotic classes and we talked about their gram coverage, the mechanism of action, and their indications. And we put all this information into a simple chart. I'm going to link this chart down below in the description, so feel free to go check that out. The goal of this video now is to give you an easy way to remember the drugs that are in each class. So starting with aminoglycosides, these medications can be remembered because their drug names usually end in mycin, spelled either MYCIN or MICIN. Some examples of aminoglycosides include streptomycin and gentamicin. Moving on to cephalosporins, these drug names usually begin with ceph, spelled either CEF or CEPH, and some examples include ceftriaxone and cefepime. There's a previous EasyMed video where we talked about the different cephalosporin generations and gave you a simple way to remember them all. So feel free to go check that out. It's in the Pharmacology playlist. The next antibiotic class is tetracyclines. These medication names can be remembered because they typically end in cycline. Some examples of tetracyclines include doxycycline and tetracycline. Next, we have penicillins. These medication names are easy to remember because they usually end in cillin. Some examples include ampicillin and amoxicillin. The next antibiotic class is sulfonamides. They can be remembered because their drug names usually begin with sulfa, and some examples include sulfasalazine and sulfamethoxazole. It's important to note that sulfasalazine is typically used to treat inflammatory conditions. The next antibiotic class is fluoroquinolones, and these drug names usually end in floxacin. Some examples of fluoroquinolones include ciprofloxacin and levofloxacin. Next, we have macrolides, and their drug names are easy to remember because they typically end in thromycin. Some examples of macrolides include azithromycin and erythromycin. The next antibiotic class on the list is carbapenems. This is also an easy one to remember because their medication names typically end in penem. Some examples include meropenem and ertapenem. Moving on to lincosamides, most of these drug names, but not all of them, will end in mycin or in. Some examples of lincosamides include clindamycin and lincomycin. And lastly, we have glycopeptides. These drug names also typically end in or mycin, and one common example is vancomycin. So to wrap this up, here again are all the easy ways to remember the drug names in each antibiotic class. I do want to point out that these are not hard, fast rules and that there are some exceptions, but if you remember this, you'll be in pretty good shape. So for aminoglycosides, these drug names typically end in mycin, cephalosporins usually begin with ceph, tetracyclines typically end in cycline, penicillins end in cillin, sulfonamides begin with sulfa, fluoroquinolones end in floxacin, macrolides end in thromycin, carbapenems usually end in penem, and both lincosamides and glycopeptides typically end in mycin or in.